Hi, Megan from Bodywise here to talk today more about how we want to work on hip mobility to help support maintaining the spine in a neutral and safe position. I'm about 5.5 weeks post spinal fusion surgery, but even if that's not the case for you, it really is important that we work on core strength and stability, and that our primary movements happen at the axis of the hips. So today we'll do a really safe hip stretch that is good for your back, good for the hips, doesn't bother the knees, and you can really sustain for a long period of time. So in order to help me maintain the neutral position of my back and make sure that I'm doing it properly, I'm going to use this lumbar support. So it's just something that I could put under my back. It's flat, it's rectangular. I could also take a bath towel and fold that. The intention is that that fills the space in the small of my back so that I'm not rounding out too much and I'm not arching. I really can't show you those motions right now just because I'm trying to be very good about the fusion. So lying down here, I'm gonna put this under my back, and how close I get to the wall depends on my flexibility in my hips. So this is a good distance for me. I'm gonna put my left foot up on the wall, you can use a couch or whatever, and then while I'm here, my back is neutral. The pelvis, like we talked about, these 3 points, the pubic bone and these 2 bones are essentially parallel to the ceiling and the floor. There's just a subtle space under my back. And without changing that, I want to cross this ankle over the opposite knee. Now, if I were too close to the wall, you'd see I'd have to lift my hips up, or my back would be really rounded. But what you're looking for is that I can really isolate that motion to the hip while the back stays stable. I'm going to flex my toes toward the ceiling and then use my hand on the same side to push that knee gently away. And that's going to bring a really nice stretch all around the outside of the hip while the back is staying very safe and stable. The other piece you want to think about is, as I'm laying here, my head is in a pretty neutral position. If it was not, and I was finding that my head was hanging back because I'm tight enough in my chest, I would use something like, again, a folded towel, depending on how thick I wanted it, maybe even a full yoga block if I'm really finding my head's hanging back. So again, very critical, even though we're talking about the hips, that we take care of the neck too, okay? All right, you can hold that stretch for 5 minutes and then be sure and switch, do both sides. I hope that helps. All right, see you soon.